I'm Taryn, the vaccine mom, and today I am talking to Dr. Maria Elena Bottazzi. Dr. Bottazzi, can you tell me a little bit about what you do?
Certainly. So first of all, I am a scientist. I am a microbiologist, which means that I like studying microbes. Um, and as I study microbes, I look for potential tools to, of course, prevent or treat or even diagnose such microbes. And therefore, my specialty is mostly in vaccine development. So I look for ways of preventing, microbial diseases using tools such as vaccines.
Love it. I have a similar background. I'm also a microbiologist and I worked in vaccines too. So that's why I was so excited to talk to you. So I know a little bit about what it's like to be a woman in science. Do you want to tell me some of your experiences being a woman in science?
Absolutely. So I actually trained in Honduras. So I'm not only a woman scientist, but also Latin American. And I was trained in Central America in my country, Honduras. And of course, as you know, that poses a little bit of struggles, mostly because of access to technology, access to, of course, opportunities within my own country. The good news is that the way that we do study microbiology in settings of what I'm going to call low middle income countries is that a lot of the work that I did during my training was very much field-based, um, uh, with a lot of connections with the community, because of course we did studies in the lab, but also outside the lab. Um, and that really prepared me a lot of how, of course, everything that I did had an ultimate relevance and an intent to come and certainly be supportive to the needs of populations. I was very lucky that I was able to, after getting my undergraduate degree, go to the United States, and I trained at the University of Florida, and then did various postdoctoral trainings in University of Miami and University of Pennsylvania, and then George Washington University. My dad always says, it's linked to what academic institutions you were at. And so that allowed me to also do a couple of things. What I call public health field-based training was complemented a lot with very hardcore technology, molecular, genetic, studies. But then also when I was in one of my postdocs in the Philadelphia area, when I was at Penn, that Northeast area that has a lot of course, pharmaceutical companies, also led me into trying to think a little bit, what is really the business of implementing science, right? And bringing vaccines from really just the scientific knowledge into the real development and implementation. So as a woman in science, therefore, what can I say? Of course, hardships, because that ecosystem is very male dominated, or at least it was. Now I think we're seeing a lot of changes. But ultimately, I think it was to really balance, science, education, the training that I had with also a little bit of the business sector mentality.
Right. Yeah, I think you brought a lot to the table. And as a woman, it's just a different perspective sometimes, which is, I think, great. I love that you work so closely with the communities too. I think that's really neat. So what led you to want to go into vaccine development?
Well, I think again, my aspiration that when I was learning about these diseases and seeing, of course, what they cause, all the burden and suffering, because I also work very specially in what we call the neglected tropical diseases. So there are a lot of infectious diseases that also afflict primarily poor people. And even in this space of now the coronavirus landscape of what this disease is causing, as you note, it also burdens very heavily in underserved populations too. And always these diseases have a way of exacerbating and becoming worse for, people that live in poverty. So, studying them, I said, we have to find ways to solve them. And I'm a firm believer that in preventive medicine, therefore, even within the aspects of essential medicines, let's call it, it's always better to try to prevent something than trying to, of course, ending up having to cure things, right? It would be great if we all would have great access to preventive medicine so that we can tackle and do things before we can, of course, get the disease. So, and that's certainly why I decided that for me, the best would be to do it through vaccines and, the use of vaccines.
I love that. I think that's so great. So we are going to have, a COVID vaccine here maybe soon. And what are your hopes for this vaccine?
So I know that people now, well, first of all, I think the good thing is that we have had an increase in the visibility of the importance of vaccines as part of the tools to tackle these types of diseases, including these very complicated diseases that are, of course, of outbreak, epidemic, and now one that we've seen with COVID of pandemic importance, which I hope people understand that it's not necessarily the normal business that we usually operate under, right? When we aspire to develop vaccines, we don't do it in such an intensity of requirement of a speed. We also never really develop interventions that are to be used for, in every single last person that lives in this world, right? Usually they're more targeted populations. So the intensity and the stress, of course, of the disease, as well, of course, of the number of people that we're developing for, it's a little bit outside of the usual. So I think my aspiration is that even though we've seen a lot of these vaccines that are under development, that ultimately people, because they may be hearing different things, don't get discouraged, and that they continue entrusting the process and trust that if we have available vaccines, whether it's 1, 2, 3, and maybe even more, and that there will be many rolling out, even not what we're going to see probably in the early in 2021, but even later on. And that in addition, the other vaccines that we already have in existence, that people use them, because a vaccine is no vaccine unless vaccinations happen. I can make all the preventive measures that I want, but again, if people don't utilize the preventive measures, they're absolutely useless. Right. And so I think that's my aspiration. And then maybe as a sidebar, because as you know, we do have a horse in the game, because we do have a vaccine that we are currently developing for COVID, that our goal, or my personal goal, is also to see that vaccine successfully advance and show that it is safe and that it is efficacious, and that we will in fact see that our vaccine is also being used by the populations that need it.
Yeah. So, there's all these people, and like you brought up, that are wondering, is this going to be safe? Is this going to be effective? Should I give this to my kids? And, some of those concerns that have been around for a long time, all these vaccines. And I think it's been a little bit more prevalent lately just because of all the COVID vaccine talk. So is there anything in particular that you want to say to these people questioning whether they should get this vaccine? Is it going to be safe? Is it going to be effective? What do you think?
Absolutely, yes. So first of all, I think you're right. This unfortunate, I guess, and thinking that vaccines may not be safe, it actually started occurring even before COVID, right? So, we know that especially in the US, but even globally, we've been seeing a lot of vaccine hesitance, as well, of course, even just not really an understanding of the science behind it. So I think if you are certainly an individual that may not necessarily feel that you understand all the information. I mean, we certainly can help scientifically because it is a complex process. That said, I think if you rely on all the historical evidence of how many millions and millions of children that we've saved uh, because of vaccinations, and the potential that these vaccines have so much body of evidence of safety, we predict that therefore the processes will apply equally to developing a COVID-19 vaccine. And I think that's why even though at the beginning of the pandemic, there were a lot of announcements that we could have a vaccine in 6 months, and then later they became 9 months, and then maybe now it's 12 months, right? It's because those were absolutely unrealistic timelines, because you do need time not only to develop the product, which is of course is a vaccine, but the evaluation of it has to be done in a way that indeed it then presents evidence that ensures the trust of those who use it, that once it's being given widely in the population, it does mean that it has gone through very onerous, very strict guidelines of quality and of course of safety. And at the same time, of course, we want to make sure it works, because even if it's safe, but it's safe because it doesn't work, that's of course not a good thing, right? So my message is, talk to your physician, educate yourself, be careful how you educate yourself, because true, you may educate yourself with the wrong information, right? You have to trust the source of the information, and make sure that, of course, it's ideally led by scientists and led by those who understand and actually have the reputation, and not just something on the web, or even political driven type of messages that I think are making a lot of disservice and providing a lot of mis and disinformation.
Right. I agree. I think, looking for accurate information is the best thing that you can do, and finding those sources um, that, are reputable, and um, just not wanting to be correct all the time. Find those things that are true, that we know to be true. So important. So there are a lot of parents that vaccinate their kids, and they do as they're told. They go vaccinate. Maybe they don't think twice. Maybe they do, but they do it. But they don't maybe go a little bit further. They could go and advocate for vaccines, but I think that maybe they're nervous and there's some fear there. What do you want to say to parents who want to get more involved in being a vaccine advocate?
Mhm. Well, I think that is very important, right? Because I think all of us as individuals, independent of what line of business you are, or what you do in life, we as human race, I think we love conversation, right? I mean, unfortunately, even now with the COVID, that we haven't been able to do things, in person. There's a lot of ways now that we do a lot of communication, right? Which is pretty much what you're asking, right? Is how do you communicate between within your family, with your friends, with your colleagues? And so that conversation is a skill that I think we all need to learn to become better, right? And it means not necessarily as a debate, but certainly more as being able to listen better, being able to certainly share our own experiences. And it's not to impose any way of, this is what I think, and therefore you should think exactly like me. So as a suggestion is, when you would like to contribute more, is just be yourselves, tell your story, right? Because most of the times the way that you have a conversation is by sharing your own personal experiences and really saying, look, I care about me and my family's health. This is the things that we do to, again, prevent ourselves to being exposed to very serious diseases. The reason why I believe on vaccines is because I have seen a lot of evidence. I believe in the systems that keep track of the safety of these medicines. It's like any medicine, right? It's not just vaccines. Any medicine that we use, or even any actions that we use, the fact that we use child seat belts when they're kids, right? The fact that we, of course, don't drink and drive, so everything is in context of public health, and that your individual protection is eventually having an impact in the community. So just use it as a conversational. Don't forget to listen, because we always try to say this, always opinionated, but not listening back. I mean, it's always good to practice a little bit of the listening, so that then when you respond, at least you know where the other individual is coming from with regards to their own experiences.
Right. I think everything you said it's perfect. I think that's exactly what we need to do. Listen more, connect more. It's stop the back and forth arguing. It doesn't work. So, you know what? This was such a pleasure. I'm kind of geek for you. I think you're so great. I love talking to you. I'm going to follow everything that you do, and I really hope you, I just wish you the best, and I'm excited to see what you do next.
Oh, thank you. And if anybody would like to just again have a conversation, right? I think it's easy to say, it's not easy to do, because we all have to remove our own biases, our own that we impositions of our thoughts, right? And I think that's how we as a society will, of course, be much better if we all were to listen to each other and have more collegial conversations.
Exactly. More compassion. All right. Well, it's great talking to you.
See you later. Bye.